Welcome all to our next fireside chat for PUBH 610, Public Health, Leadership, and Management. I'm Cezar Lopez. I'm one of the professors teaching this course, along with my colleague, Professor Lili Warren. As part of our fireside chat series, we're giving our students the chance to hear from impactful leaders in public health. And today, we're very fortunate to have Dr. Chinazo Cunningham join our classes. Our students are excited to learn more about your experience as a public health leader. So to start off with introductions, Dr. Chinazo Cunningham was appointed by Governor Kathy Hochul as the Commissioner of the New York State Office of Addiction Services and Supports, OASAS. Dr. Cunningham is a physician, a researcher, and a public health professional who brings over 20 years of expertise in substance use treatments to OASAS. Prior to joining OASAS, she served as the Executive Deputy Commissioner of Mental Hygiene at the New York City Department of Health and Mental Hygiene, was a practicing physician at Montefiore Health System, and a professor of medicine, family and social medicine, and psychiatry and behavioral sciences at the Albert Einstein College of Medicine. Dr. Cunningham has more than 20 years experience in research, care, and program development that focuses on people who use drugs. She has also partnered with community-based organizations to develop pioneering programs to promote the health of this population. So with that, welcome, Commissioner Cunningham. It's the last week of our semester, and we're exploring the future of health service delivery. So let's start off by looking forward. What are some up-and-coming issues that you're focused on in your work these days?
Yep. So let me just say thank you, and I'm happy to be here and have the opportunity to talk to students. So I think, I would start off by saying that, we're in the worst overdose epidemic ever on record in this country and in New York State. And so that has to be what guides all of what we do. And so we have real new opportunities to think about how we deliver services across the state, given, really the devastation of the overdose epidemic. And so part of what I am really see as the vision at OASAS is to, number one, embrace harm reduction. Number two, use a data-driven approach that really embraces evidence-based strategies. And then number three is to have an equity lens in everything we do. And so harm reduction is really it's a philosophy about, recognizing people use substances and really focusing on reducing the harms associated with those substance use. And it's an approach. It's about meeting people where they are. It's about reducing barriers. And then it also includes providing supplies that can help save people's lives, like naloxone that can reverse an opioid overdose. And so that focus is really about keeping people alive. That is the primary goal. And also part of that is really meeting people where they are. So that means as providers, as a system, we can't wait for people to come to us. We have to go out into the communities and really meet people where they are, engage them. And so that might mean engaging people on the streets or on the subways, in homeless shelters, in jails, and in prisons. And so that's where a lot of our work is aiming to really sort of go out and provide services where people are. In addition, really using our data to drive that process. So where in the state are is the overdose highest? Which populations are experiencing this, the most? And so we know, for example, that Black people and Hispanic people have the highest overdose death rates. So really targeting our investments and our efforts in those communities that need it the most. And then, the equity lens, so part of that is data. And part of that is really recognizing some of the racist policies that have existed in this country. The war on drugs was essentially a war on people of color. And we have to recognize that and make sure that we don't make those same mistakes going forward. And so everything that we do, from our regulations to how we provide financing to what kind of data we collect and what we analyze, really have to be informed by an equity lens. So I know that's sort of a long answer, But really that is our vision here at OASAS is, embracing harm reduction using a data-driven approach that uses evidence-based strategies, and then using an equity lens in everything we do.
Great. Can I follow up about something? So, I mean, these three aspects, harm reduction, data, and equity, it sounds like this could take a lifetime, a generation of professional commitment. Are you, as you've been doing your work, is there parts of this that you feel optimistic as starting to be accepted, starting to turn the page?
Yeah, so I mean, it's interesting that you say it takes a lifetime. It does take a lifetime, and in fact, this approach is not new to me at all. This is what I've been doing my entire career, So so I practiced medicine, in a federally qualified health center in the South Bronx for 22 years, and that being on the ground and really seeing what people are struggling with and communities are struggling with, that informed everything, right? These aren't ideas that I just had in my head or read from a textbook, right? These are ideas that I lived through, that my patients lived through, their families lived through, the communities lived through, and really thinking like, we got to do things differently. People are dying, right? We have to think differently, and how to do that, and how to partner with communities, and how to really harness data. That, so it, for me, it has been decades of doing this work and really sort of coming, to recognizing just how important this is, and then getting other people to recognize how important this is too, right? So I think that, for some people, for example, harm reduction may seem new. It may be new for some parts of the state and some of the providers. For others, they've been practicing harm reduction for decades, right? And so I think that as addiction has really impacted all parts of our country and our state, that it's harder and harder for people to sort of think that doesn't apply to them, right? And it's personally impacted so many people and families and communities. And so I think people have come to realize that we can't just keep doing the same thing and expect different results. And so I am hopeful that there is a sense that people are willing to think about things differently, and people are willing to do things differently. And you can see the change at the federal government, actually, right? So this was really in the last year or two was the first time the federal government used the words harm reduction, gave money and funding for harm reduction, has harm reduction as part of the strategic, approach. So that's fantastic, right? So it's not just me coming into New York like, oh, there's this crazy person. Of course, no, right? That there's a movement of many people and public health and the provider community really recognizing we have to do things differently. We have to focus on keeping people alive, and really embrace this approach. So, not everybody's there. It's not Pollyanna. There's a lot of variability. Some people have been there for decades. Others, this is still new, and people are sort of struggling with this different approach. And that's where we come in at the state government level, is to help move people along to understand what is harm reduction, what does that look like on the ground? How can we help support that, facilitate that, fund those kinds of efforts, make sure that our regulations match what that expectation is. And so really trying to put that in practice, and help people come along and programs come along. That's a lot of what we do.
Right. Thank you for highlighting that progress. Lili, over to you.
Thanks, Cezar. And thank you so much, Chinazo. Quick follow-up on what you were just sharing about racist policies. I'm just wondering, at OASAS right now, are there particular policies and regulations that you're focused on in your work, either undoing existing policies that we know were not developed with an equity lens in mind, or new policies that you're trying to put in place right now?
So one of the first things that I did when I came to OASAS is I established an Office of Justice, Equity, Diversity, and Inclusion, so a JEDI office. and then created a new position, which is our executive equity officer, who leads that office, and that office is, I want to say, 4 people. So it's not a check the box. It's not a sitting in the corner. It's really somebody who is, the office is fully involved in all of the work that we're doing. I wouldn't say there's one specific policy, but it's really reviewing what we do and how we do it across the board. So some of the examples are, how do we choose, what is the process in which we select applications when we put out a request for applications? So we want to start a new initiative, right? And we want to fund it. So we put out a request for applications and we get a bunch of applications back, and then we score them and then decide who gets funding. So part of the process has changed to include in that scoring process, how do these programs address equity? What is their leadership makeup? Does it reflect the people they serve, right? Who's the population that they serve? And so now there's a section on all of our applications that specifically addresses equity, and that's part of the scoring process to then figure out who gets funding. So it's building in, right, these kinds of structures and processes to make sure that we're addressing equity. We've done an equity assessment in our agency. Where are we? How do people feel? Do they feel included? Do they feel like, right, that they're valued? So we've just spent a year doing that with an outside consultant and then feeding that back to our agency. We also want to make sure that all of this, that our equity work is really across the entire agency. So we have what we call a JEDI, Justice, Equity, Diversity, and Inclusion advisory committee that's internal, so that it represents people from the financial department, the legal department, harm reduction, treatment, recovery, right, our certification process, so all the parts of our agency, so that we're going to weave this into everything, right? Regulations, the certification process, the funding process, the data collection process, the data analysis process, all of it. And so that, again, building a structure so that it's inclusive and across the entire agency, to really think about all the work and having that equity perspective sort of at the table. So those are the kinds of examples. Another one is we just developed what we call the LEAP, which is the Lived Experience Advisory Panel, making sure that people, who have lived experience have a voice at the table. They are going to advise the agency and me, right, on, our policies, our, initiatives, our, all of it. And so, that's the first time that's happened. We put out, and just to give you an example of the kind of response we got, so it's a committee, I want to say there's about 30 people on the advisory committee. We had 180 applications. And so we were very excited about that people want to be part of this. They want their voices to be heard. I want that too. And I know how important that is, to make sure we're on the right page, right? We're going in the right direction. We have to have that voice at the table. So those are some examples of like real concrete changes that we're making in the agency. And we have a lot of work to do. It's not going to happen overnight, but it's making sure that it's woven into all of the work that we do at the agency.
Thank you so much for highlighting some of these best practices, which definitely also translate to our work at the health department, and when it comes to grants and selecting applicants and addressing equity throughout the whole process. So thank you so much. Cezar, any follow-ups from you? Okay. So, Cezar and I had the opportunity of getting to know you as a leader during your time with the New York City Health Department, which was a great experience for us. We'd love to ask you some questions about your leadership style, and your experiences as a leader in different settings. So what are your goals as a leader? How would you describe your leadership style? What are your strengths and what are your areas of growth or development?
So, I would say that my leadership style is one of inclusivity, transparency. I think that those and really clear communication. So, I think as a leader, the job as a leader is really to lift up the people around you, to lift up, so for me, we have an executive team, right, that oversees the financial part of our system, the legal part of our system, right, the communications and government affairs, and then we have prevention, treatment, harm reduction, recovery, so the workforce, et cetera. So really it's to have those leaders be the strongest that they can be so that all parts of our agency can be strong, right, and contribute and be thoughtful. So, certainly I don't have all the answers. When we bring people together with different perspectives, that's when we're best, right? We're dealing with very complex problems, right? If it weren't complex, we would have solved the problem already of addiction in this country, right? We wouldn't be where we are with the overdose epidemic. There's no one answer, clearly. And so, how do you solve the problem? You get good people at the table who have different kind of perspectives, right, to really think about what do we need to do to solve this problem, and empowering them, and bringing them in and making sure that they're valued, and making sure that they are sort of getting the best from their staff as well, and then contributing makes everybody better. So really thinking sort of the collective, of the group, of helping elevate everybody, bringing the different perspectives to the table, to really solve the problems. And then transparency is really important. Look, there are very difficult decisions that have to be made, right? We can't do everything. And I think while people, are upset, for example, if they have cuts to their program, or upset if their part of the vision doesn't move forward, I think that, providing that clear communication and rationale as to why decisions are made, people understand that and respect that, right? So you're not going to agree with everything that anybody does, but at least if you understand the reasoning behind that, I think, it's easier to sort of accept that. So when there's lack of transparency, there's opportunity for all kinds of things to swirl around, and conspiracy theories and all kinds of things, which ultimately undermines the work, getting done. And so I think that is also a very really important part of the work that we do. And certainly as a leader, I have town halls all the time to sort of talk about updates and what we're doing, and have a lot of opportunity for people to ask questions. So we have these town halls internally, we have the town halls externally, so with our providers and our stakeholders, so that there is opportunity for them to hear from us, and from us to hear from them about what the issues are, and to really consider some of the feedback. We certainly have changed course if we're not on the right course, and we really hear that and think about it, and take some of the feedback back and rework our direction. And so that kind of flexibility, that willingness to really hear from others, especially those who are on the ground doing the work, having the opportunity, really to listen and then to be transparent, is really important.
I just to reminisce a little bit about your time at the New York City Health Department. This is more of just a comment. I certainly appreciated and respected your technical experience, expertise, your communication, your leadership. But one of the things that I really reflect fondly on is some practical things that you did to bring people together. And I'm talking specifically about the summer barbecues, summer 21, summer 22, in the, still in the middle of the pandemic, socially distance outside. But I think that was a really meaningful leadership initiative to get people who are siloed and also people that are working remotely in front of computers all the time to be able to see each other again, to build bridges. So I just wanted to say that I really enjoyed that. And I think that that's probably a really good another example of you bringing people together.
Yeah, I mean, thank you, Cezar. I think, the other thing is everybody wants to be seen and heard, right? You want to, and I think that people need to be, their work needs to be seen as to why their work is important and how it contributes to the larger goal. And so I do think that, like, how can people see themselves and their work in where the agency is going and the vision of the agency, right? Because we can't do the work without everybody. We need everybody, and all of the work contributes. I think sometimes it's harder for people to see that, and my job is to make sure people do see that and people do see the value that they bring. And I also think that we're human beings, right? We're not like, computers or robots. And so the human element of it is also really important, right? That understanding that, like, we have good days and bad days, and we have other parts of our lives that are also important, and being able to have space for that, right? And to, like, be able to draw that in, I think is also important, because when people see their colleagues as human beings, then there's a lot more empathy and a lot more willingness to accept the imperfections that we all have, right? And so that, like, people sort of getting to know the other aspects of each other, I think is really important for the kind of, like, environment and working relationships that succeed.
I love that. Thank you. One follow-up. You mentioned, which I assume to be a very common experience among leaders, the need to make difficult decisions sometimes. I was wondering if you could give us an example of a recent difficult decision you had to make and kind of how you approached it using your, communication, transparency, inclusivity skills. If you're comfortable sharing an example.
Yeah, absolutely. So, well, I mean, one is easily comes to mind because we have our budget that has now been enacted for, the next fiscal year, and our agency had budget cuts. So we had to figure out what we were going to cut, right? Of course, that's not an easy exercise at all, because all of the work is important. And so, but we have to make a decision. We have to make a decision, right? We don't have the choice of not making a decision. So part of what ended up getting cut is the vocational services at OASAS. And so those are the services that are embedded in our programs that include a vocational counselor and really help people develop their skill sets to be able to get jobs. And, having a job and having that skill set is an important part of recovery and supporting recovery, so that, as people who have addiction, right, can contribute and, really have another part of their life that they can focus on. So definitely an important part of our all work, but we had to make cuts. So, we've heard very clearly from our community and the providers about their concern about these cuts. And so we're working internally to figure out how we can still support this function, but really think about maybe a different model of doing that still, won't it's not going to restore all the dollars, but it can still get at what the ultimately is. We want to support people to be able to work. How can we do that in a way that maybe looks different, that's a different model, but still that function is available for all of the people in our who receive our services. And so those are internal discussions that we're having right now, right? So a lot of people are not happy because they're getting budget cuts, right? We recognize the need for this function and activity. And so, we have to come up with a different way of being able to still address that. And I think we can. I think we can figure it out. And we're in the process of figuring it out. But that's the kind of thing where, it is a difficult decision. We made, we said these are the things that are going to get cut. And now we're sort of figuring out how we can still, while cutting that, still at least preserve some of the functionality in there, but in a different way.
On to our next question. So our students have been organized into different groups of 3 or 4, and they've been responding to a public health issue using principles of public health leadership and management. And they're working on either COVID-19 crisis or the drug overdose crisis in different states. For an assignment, our students will work on preparing an elevator pitch to the governor of their assigned states for a program or a policy intervention. Can you share an example when someone delivered an elevator pitch to you that resulted in a decision to support the project or give an innovative idea a chance?
Yeah. So a couple of things that I would say about elevator pitches, right, is the first thing is they are very brief because people that you're pitching to don't have a lot of things and don't have a lot of time. And so once people sort of begin to sort of ramble, it's gone. My attention is gone. I'm moving on. I don't have time for that. So that's what I would say. And the points need to be communicated very clearly, right? So defining what the problem is, right? And then coming up with very clear potential solutions. So one of the things that this is an example. So one of the things that I did when I first came to OASAS was to consider we had several different kinds of ad hoc advisory committees that played different roles. And, I wasn't totally clear on what their functions are or how the makeup was. And so I sort of paused that work. At one point, one of the providers really focused on how much of the challenge we're having with the workforce, which we definitely recognize that, right? And we've really been thinking about a lot of different ways to support the workforce and to bring people into the field of addiction. And again, no one answer, no silver bullet here, right? It really is a multi-pronged approach to really think about both supporting the current workforce and the future workforce. So one of the providers, really talked about how exactly this workforce issue was impacting her programs, and said to me, we have all these ideas. We've been able to be successful in these various ways. We want to work with you and tell you how we've been, how the programs have been successful, so we can learn from each other, and you guys can sort of pick up some of the examples of the programs that we've had. So, I think it's a good point. And so we reconstituted, our workforce advisory panel, and, was very purposeful, again, using an equity lens. Who was on that? What did that look like? Making sure it was equitable for the small programs, big programs, urban, rural, upstate, downstate, right? All of that. It was representative of the state. And so things like we heard, some people have interns, right? People that intern at their programs stay at their programs. So we're, we came up with our programs, hearing what they had said, have developed a paid internship program because we want that. right? We want, if we pay interns to come into our addiction programs, the likelihood that they're going to stay there is great. And so we can incentivize that. We can incentivize people to do their internships at addiction programs instead of another part of the healthcare system. And so that's a great example. So that's now up and running.
Great. Thank you for sharing that. We don't know when the students are going to have a real life opportunity to deliver a elevator pitch. So it's sometimes in some ways also kind of hard to teach, but thank you for sharing that information. Lili, over to you.
We personally think, Cezar and I, that a future commissioner of health, or maybe commissioner of OASAS, could be a student in our class watching a recording of this conversation. So if you had to share a few key messages with future public health leaders, maybe starting their careers, maybe somewhere in the middle, what would you like to share?
So, I think probably a couple of points, which is be curious, right? Ask questions, meet with people, talk to people, ask questions about why this, what's going on here, what are the issues here? How do the politics affect this? How do the science affect this, right? I think the curiosity is so important. And I think a lot of us come in with a certain kind of expertise. I came in with medical expertise, right? And research expertise. I can tell you the political landscape was totally novel to me. So and to my staff, not at all, right? That they're experts in understanding how the politics affect what we do. And so I was constantly asking questions and really reading and learning, and this whole other area that I had never really paid attention to. Because I just sort of said, it doesn't really apply to me. I'm just going to, do my work and do my research. I mean, of course, politics applies to everybody. It affects everybody, some more than others, but it really, right? And so having that curiosity and asking those questions about what did that mean and what does this mean, and I don't understand this thing that just happened, and why did that happen, and how do I connect the dots, is really important and informative. And so I feel like I'm constantly learning. I'm a lifelong learner, and the learning has shifted tremendously from learning medicine and the human body and diseases to then learning about data and research and how that can guide what we do, to then learning about how do policies and politics really affect what we do. And so really totally different areas, but all very much linked and important to inform the work that we do every single day. So being curious is really important, and really knowing that it's lifelong learning, because the world is constantly changing. And this is also one thing that I see opportunity when the world changes. I think sometimes people see threats, like, oh my God, things are going to be taken away from me because there's a change. But one example of this is, for me as a researcher, well, there's a couple of different examples. So when I went to medical school, we didn't have sort of the, addiction crisis that we're in now. We didn't have buprenorphine treatment or Suboxone treatment for opioid use disorder. It was not FDA approved. And so it was, I was probably 10 years into my career when it was like this new medication was approved for the treatment of addiction. And I saw that and said, oh my God, this is a game changer. This is an absolute game changer. Not because that medication gave us the opportunity to address addiction in a widespread way. So that medication and treatment then could happen in emergency rooms, in hospitals, in any clinic, in a park, on the street, right? In a mobile unit, anywhere, in a jail, in a prison, in a homeless shelter. And before that, we only could treat addiction in these very specialized addiction treatment programs with methadone. So for me, like, it was very clear from the minute that that medication was approved by the FDA that this was a whole new way to go forward. So that's like one example of really seeing like this is an opportunity, this is a game changer, right? The other big thing is cannabis, right? When I was in medical school, nobody would ever believe, 20 years ago that, like, 35 states have, legalized medical cannabis, and 18 or 20 states, I've lost count, have legalized adult use cannabis. And obviously in New York, we're in a totally different place with all of the adult use cannabis. Nobody would have believed that that's where we would be. And again, that leads to so many questions about what is the role of cannabis? What does it do? What are the harms? What are the potential benefits? What should the policies look like? How should this, right? All of these questions. And so again, seeing that when medical cannabis was approved in New York, I ended up doing a lot of research around medical cannabis to try and understand its role in pain and in opioids, really. Because, right, I was coming at this more from like addiction, and could cannabis be a way to reduce the use of opioids, right? And then have an impact on less opioid addiction. So again, the world changed, there's this new opportunity, and, sort of seeing that as opportunity and change, I think is really important. So sometimes I think sometimes with young people and students, people can be very hyper focused. Like, I know what I want to do when I grow up, and I'm gonna, do this, and in 10 years from now, I'm gonna be in this position, and blah 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 blah. And that's great, but not at the expense of seeing what's happening around the world, right? So not at the expense of having the tunnel vision and the blinders on, where when these shifts happen in the world, that they're so focused on the end goal that you don't sort of appreciate this like major shift that's happening in the world, and how that can then lead to opportunities or impact, public health, or, just societies. So that is really important, is that, being the curious, lifelong learning, and then really seeing major changes as opportunities and shifts, and really not ignoring that, but embracing that as and and all of the possibilities that could come from that.
Thank you so much. I'm reflecting on the curiosity piece, because for me also in my career, I've found that being curious is one thing, and then finding the right people to answer your questions is another. And sometimes it's not necessarily, your direct supervisor, or, it's finding mentorship and finding people who share that excitement and curiosity to ask those big complex questions, or to fill the gaps, or to, link those dots. And so I completely agree that finding the right places and the right spaces to be curious has been, for me, a very important aspect of my career, or something that I, strive to continue to do. Anyway,
yeah,
I would,
yeah. I totally agree with that. And I do know, early on in my career, I really kind of struggled with like, who should you mentor me, right? Like, because part of me was, so, I have 3 kids, they're all now in their 20s, but early in my career, my kids were little, and I really it was very challenging to balance work and family. And so, who else was experiencing the same thing? How did they address this? How were they able to be successful in their career, but not sacrifice everything, in terms of family? And then who was, focusing on addiction, and who was focusing on harm reduction, and who was focusing on research? And I was like, where is my mentor, right? Like, who can bring all these things that I'm struggling with to understand, like, how to move forward? And so I really naively thought that there would be like a person who could embody all of those things, which was clearly not the case. So often it takes a team of people, and really seeing like, oh, this person can help me think about this, and another person can help me think about that, and another person can help me think about this, right? So really seeing that different people can provide some mentorship in different ways. And really having to be proactive, knocking on doors and sending emails and asking people, that you want to learn from them. And I think for so many people are happy to do that and happy to be part of that, but also to think broadly about that, right? Like I got mentoring, some of my research mentoring was from like MPHs, not MDs. And that's like, in the world of like doctors, it's like, oh, it should be the doctor, the MD or the PhD. Not necessarily, right? Not necessarily the people in my trained field. I got a lot of mentoring from a pediatrician. I'm an internist, right? And an addiction medicine doc. So this person had nothing to do with the same content that I was working with, and so really thinking about and I worked and got a lot of mentoring with it from an epidemiologist, right? So people that are not necessarily so hyper-focused in your field can actually be helpful because they can see things more, a little bit more broadly. And so that's all, really important, along with a sort of team, because different people can provide different kinds of mentorship. And I found that like very useful. So I do think mentorship is super important, especially for women and especially for people of color. And I would encourage students have to be proactive in this. And, sort of, this is your career, this is your life. And don't you want to, do the best you can? And you've put in all this time and investment into it now, right? So it deserves that to think about it in a strategic way, and helping people who have gone through that and who know these systems, is really important to help make sure that you're strategic and you're really using what you've invested in yourself, to the best of your ability.
Thank you for sharing that wisdom. We wanted to give you a chance to talk about, to deliver some closing remarks if you wanted. And if you want to talk about, some students might be graduating, if there's ways to specifically get involved in OASAS or the issues, please feel free to share it.
Yeah, absolutely. So we're certainly, looking for people who want to do this work in the field of addiction, and people who, bring energy and new ideas and, to the field is always lovely. I mean, one of the best parts of my career has really been working with, younger people early on in their career, and just seeing all of the enthusiasm and curiosity and being able to play a role in their development is incredibly rewarding. And then they go off and they change the world, and they change the world in, everywhere, New York City, New York State, Washington, Louisiana, you name it. That is like incredibly rewarding as, as somebody, from the mentor position. I think, again, I would say, you're all making, a really big investment in yourselves, and that's great, in your career, and continuing to think about that investment over the path of your career is really important. And I think, so that's where the sort of curiosity, piece plays out, the lifelong learner plays out, seeking mentorship at all stages. It's not just when you're young, it's at all stages, right? It's different kinds of mentorship as we sort of go through our career paths. All of those are important. And, I think ultimately, the goal is to be able to be impactful and to be the best versions of ourselves, so that we can then contribute, in a way that's unique and helpful. And I think that all of these principles that, apply. So the curiosity, the lifelong learning, the continued mentorship, and continued, paying attention of what's happening across the society, and seeing potential opportunities to have an impact.
Thank you so much, Chinazo. That was wonderful. Thank you on behalf of our students and ourselves for joining our fireside chat today. And we will.
Well, thank you. Thank you for inviting
you.
me. Happy to have the opportunity.
Thank you.
Thank you.